In this video, we will address which surgery is good for you, whether one should have the sleeve surgery or one should have the bypass surgery. There is a lot of confusion about these two surgeries in people's minds, and a lot of time people do a lot of research and they don't know which surgery they should go for. So I think the best way to go about it is to have a proper discussion, to come and meet the bariatric team and to understand the pros and cons of both the operations, because there is no set formula and not every surgery suits every patient. So it's important to understand what would suit you the best. Now, when we talk about a sleeve surgery, a sleeve is basically a surgery where we remove the outer 2/3 of the stomach, creating a sleeve which is basically like a banana-shaped stomach. There are a certain set of patients in which we will not do a sleeve surgery, and these are basically patients who have a lot of acid reflux or patients who have a large hiatus hernia. Now, because a sleeve is a refluxogenic operation, and the other concern with a sleeve gastrectomy is that in our experience, we see that a larger proportion of patients with sleeve gastrectomy tend to regain their weight back. Now, this is not universal. It's not necessary that everybody will regain their weight, but yes, a higher percentage of patients definitely regains weight more as compared to any bypass surgery. Compared to this, a bypass surgery is a little more complicated surgery where we would create a small pouch and we would read out their small intestine and attach it to the small pouch of the stomach. These are surgeries which are like I said, more complicated as compared to a sleeve surgery. They're good surgeries. They definitely have better outcomes in terms of improvement in diabetes, in terms of improvement in other problems. They also take away acidity and acid reflux, and they are the procedure of choice for these kind of patients where जिनको acidity या acid reflux की problem होती है. Now, the flip side for a bypass surgery is that क्योंकि इसमें हमने रास्ता चेंज कर दिया है, food is not passing down through the normal course, it's going through another pathway, so there is some degree of malabsorption also involved, and आप कुछ nutrients absorb नहीं करेंगे जैसे कि vitamins, calcium, iron. So ये दवाइयाँ आपको lifelong continue रखनी है. So this is the only ask for a bypass surgery. Now, when we discuss it with our patients, we would always ask that would you be taking medications for all your life? So if a person is not confident about taking supplements for all their life, then I think they should not be going for a bypass surgery. ऐसा नहीं है कि sleeve के बाद भी आपको नहीं लेना है, but generally the number of deficiencies after sleeve surgery would be lesser as compared to a gastric bypass. With a gastric bypass, there would be a compulsion to take nutritional supplements for all your life. So that is another deciding factor. So there are many things which actually go into patient selection and procedure selection, and this is a detailed discussion which should happen between the patient and the doctor. And then whatever the patient feels comfortable with and the doctor feels is good for the patient, I think basis that a mutual decision should be taken which is suitable for both and appropriate for the patient and would be good in the long term for the patient. And that's how we would proceed further. Thank you so much.